Please rise to join us in the singing of the national anthem.
Stripes and bright stars through the perilous fight. O'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. Well, good afternoon. I'm Tim Beebe. I'm the Interim Dean of the School of Public Health, and it's my great pleasure to welcome you all today to this commencement ceremony for the student class of 2022. What a great day. It's beautiful weather, beautiful venue. It's great to see the students, their families, my colleagues in 3 dimensions once again. It's especially important and exciting commencement ceremony as it's the first we've had held in person since 2019. It's really hard to believe that. That said, being the School of Public Health and with prevention as our foundation, just want to remind you that cases are increasing in Minnesota and Minneapolis, and I invite you to keep your masks on if you're wearing them as you approach the stage. I'm also like to welcome those joining via the live webcast of today's ceremony. Given the geographic diversity of the student body, I'm sure there's so many people from around the world patching in today. Did you know that our students represent 23 different countries and 36 different states? What do you do now? So you can also follow us on Twitter and can offer congratulatory messages using the hashtag SPHGrad, capital SPHGrad. Faculty, you're invited to join in that too, sending nice notes. And as Professor Gaulis said on Twitter, she's gonna be taking a lot of selfies. So please do that and share congratulations with the world via Twitter. Before we begin, I want to acknowledge that the School of Public Health at the University of Minnesota Twin Cities is built within the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Makoche, which loosely translates into the lake where the waters reflect the skies. It is important to acknowledge the peoples on whose land we live, learn, and work as we seek to improve and strengthen our relations with our tribal nations. We also acknowledge that words are not enough. We must ensure that our institution provides support, resources, and programs that increase access to all aspects of higher education for American Indian students, staff, faculty, and community members. So every commencement, and this is my 6th commencement, reminds us as faculty why we've chosen this career in higher education. You, our students, came from around the world to Minnesota for professional purposes and to sharpen your scientific skills in order to make the world a better place. That's the fuel that drives us all. We, as faculty, are honored to have been your partners in this journey. And as you launch yourselves into doing the great work that you will do, this today is just a milestone. toward the future that you want to for yourselves and others. In your commencement program, and it's a really nice commencement program, some of the factoids I just offered are actually in there, so you probably knew it already. You'll see that some students are identified as members of the Delta Omega Honorary Society in Public Health. The society was founded in 1924 at Johns Hopkins University, and there are now more than 100 chapters throughout the US and abroad. Our Pi chapter has more than 800 students, faculty, and alumni members. Membership in Delta Omega reflects an individual's dedication to increasing the quality of our field, as well as the protection and advancement of our health, the health for all of people. Members are chosen through a selective process that considers their outstanding performance and devotion to the field. Let's congratulate this year's student inductees. Since 1944, our school has worked diligently to give every person the right to a healthy life. This year, we'll be awarding over 300 certificates and diplomas to our students. For 78 years, we have prepared some of the most influential leaders in the field and transformed the way public health is practiced around the globe. For the next 78 years and beyond, we'll do the same thing. We'll be proud to continue to play an important role in shaping generations of public health leaders and practitioners. So we have a wonderful ceremony today. Many thanks to everybody who's worked on this. It's quite a production. But let me first introduce those on the stage. When I call your name, please stand so we can recognize you. Representing the University of Minnesota Board of Regents, Regent Ruth Johnson. Representing the University of Minnesota Office of the Executive Vice President and Provost, Dr. Brian Sick. From the School of Public Health, Associate Dean of Education and Student Engagement, Dr. Betsy Wattenberg. Wow, fan base. And Associate Dean for Research, Dr. Marizan Ramirez. I'd like to introduce, well, he's a man that needs no introduction, Dean Emeritus and Professor, Dr. John Finnegan. You know, he has shepherded this school for 17 years and then handed it over to me in February. So he's left giant Shaquille O'Neal type shoes to fill, and I'm grateful that he's here tonight. Past president, or our commencement speaker today is Dr. Nathan Chomilo. The past president of the School of Public Health Alumni Society Board, Karen Wick, class of 1994. This year's University Mace Bearer, Greg Hart, class of 1976. He said the mace is very heavy, so he's been doing jazzercise for the last 6 weeks to get ready for this. Our 22-23 SPH Student Senate President, Kaylin Almach. In class of 1922. No, that's the wrong fact. In class of 2022, student speaker Delaney Anderson, a candidate for an MPH in maternal child health. We'll be hearing more from her later. So our school represents one of the most diverse academic environments at the university, and you can see some of those stats in the commencement program. Our faculty come from backgrounds in more than 12 or 24 different fields of study. Let's recognize our outstanding faculty now. As I name you, please stand and remain standing throughout this. And audience, please don't clap until it's, I'm sounding really bossy right now. Don't look me in the eye. Stay standing until I run through them all. So I'd first like to introduce Professor and Interim Head of the Division of Health Policy and Management, Dr. Jean Abraham. I'm always looking the wrong way. What did I say? Professor and Head of the Division of Environmental Health Sciences, Dr. Bruce Alexander. Professor and head of the Division of Epidemiology and Community Health, Dr. Diane Newmark-Steiner. Tonight, Dr. Joe Koopmeiners, the chair of the Division of Biostatistics, was unable to join us, unfortunately. So we're happy that these leaders have joined us and for all that they do. And I also want to recognize all the other faculty in the school. Please stand, if you will. Now you can clap. I just got a surge of power out of that for some reason. So our faculty is dedicated to equipping our students to respond to the most pressing public health concerns: a changing climate, a newly emerging and re-emerging infections that we know too much about, a rapidly aging population with distinct needs, and persistent structural racism that causes health inequities, the changing health economics of healthcare, and a deluge of digital data in the healthcare and public health space that is a potential treasure trove if we use it wisely and ethically. Our faculty and students are committed to having an immediate and long-lasting impact on our communities. The graduates of our certificate programs have gained skills in focus areas of public health to augment their current careers and improve the health of our communities. Our Master of Public Health grads will shape public policy, develop evidence-based programs and outreach, and work with public health agencies, non-governmental agencies, healthcare, and myriad settings that are dying to have their skill sets brought to bear. Our Master of Science graduates have honed their skills in big data access, management, and analytics. They'll bring their skills as clinical researchers to the world of public health. Our graduates of our Master's Healthcare Administration program will serve the changing landscape of healthcare and forge new and sustainable futures for those organizations. Our PhD grads will become the next generation of public health scientists. About half go into the academy and half go to other areas like government and industry. I'm not sure you're supposed to still be standing. Wow. Now you know the power of the dean. Sorry about that. There's water under your chair. So regardless of the degrees, our students are well positioned to shape a healthier future for all people. Our programs and research have evolved over the past 78 years. We're kind of like shapeshifters. We respond to the needs of the day. For example, a once-in-100-year pandemic on a novel virus. But what has remained invariant and what's our North Star is a dedication to protect and promote health of populations around the world. Okay, for you, our graduates, you're going to be facing some headwinds, not to be a buzzkill or anything. You're going to be facing rising economic inequality and its impact on health and health inequities. The unimaginable challenges that will arise of a changing climate will be very difficult to navigate and understand. The inexorable rise in gun violence. There's been 200 mass shootings so far this year, about 10 a week. We've had 3 mass shootings this weekend, one motivated racially, declared a hate crime. So it's a reminder that gun violence and racism continue to be public health crises. Okay, that's grim and daunting, but we have faith in your ability, given the skills that you've accrued and the perspectives that you have, that you'll be able to meet these demands and challenges and create and shape a healthier world. You've navigated through so much these past few years to get to where you are today. I think this adversity has uniquely situated you to take on the hardest challenges and to pivot depending on what they are. You're to be commended for your grit and perseverance. We are enormously proud to have played a role as teachers, mentors, advisors that have helped you to develop the tools you'll need to make a difference in these daunting areas. But you don't have to do it alone. Public health relies on effective partnerships. and we encourage you to stay connected to the school, its faculty, and to each other as your careers in public health develop. One essential partner for us is joining us on stage today. It is my honor to introduce today's commencement speaker, Dr. Nathan Chomilo. Dr. Chomilo is the medical director for the state of Minnesota's Medicaid and Minnesota Care programs and practiced as a general pediatrician with Park Nicollet Medical Health Services and Health Partners. He also served as the state's COVID-19 vaccine equity director and is currently a senior advisor on equity to the Commissioner of Health, Commissioner Jan Malcolm. A native of Minnesota, Eden Prairie, he told me. I don't know if you want me to share that or not. He received a zoology degree from Ohio's Miami University and graduated from the University of Minnesota Medical School, so he's a gopher. He completed his combined residency in internal medicine and pediatrics at the University of Minnesota and was the pediatric chief resident at the University of Minnesota Children's Hospital. He can't quit us. Dr. Chomilo is also one of the state's most prominent voices in achieving health equity, and he co-founded the organization Minnesota Doctors for Health Equity. His advocacy work has included promoting the impact of early childhood intervention and healthcare access, what they have on the long-term prospects for our children, and how physicians and health systems can address racial and health inequities. His work has not gone unnoticed. The City of Minneapolis Department of Civil Rights recognized him as the 2019 History Maker at Home recipient. Minnesota Physician, the Journal, named him one of the 100 most influential healthcare leaders in 2020, and you'll soon hear why. And the Minnesota Medical Association honored him with its President Award in 2021. We are now in a national movement when public health and healthcare have the chance to overcome their own histories and be a force for sustainable change in how our country secures the right of all people to lead a healthy life. We're extremely pleased and fortunate to have Dr. Chomilo with us today to share his thought. Please join me in welcoming Dr. Nathan Chomilo.
All right, thank you, Dean Beebe. Good evening, University of Minnesota School of Public Health class of 2022. And also very important, good evening to the friends and family of the School of Public Health class of 2022. Let's all give a big applause and shout out to partners, spouses, parents, grandparents, siblings, and everyone in your crew that is here today, in person, virtually, or in spirit, celebrating this milestone moment. I want to start by acknowledging how incredible an honor it is to be invited to speak by this year's graduating class. I know I wouldn't be standing in front of you today without the support of my wife, parents, family, and friends, but not all of my family gets it. I told our 5-year-old that Daddy was asked to give a big talk, and his response was, "Why?" He next wanted to know if I was going to do a dad joke. So I asked him which one he thinks I should do, and he said, "My favorite one." So here goes. What do the buffalo say to their sons when they drop them off at college? Hey, bye, son. Yes, we got some Buffalo fans. All right. Well, class of 2022, your parents and loved ones have dropped you off at college and now graduate school. However, you may still relate to that first question my son asked, one that many parents and caregivers of 5-year-olds are no doubt familiar with. Why? A simple question that is important to reflect on as we celebrate the class of 2022. Why public health? Why now? As we entered this new year, my personal reflection led me to 2 questions that I will frame my time with you today around. What is your reason and what is your season? Why public health? Why now in year 36 of a pandemic? Wait, what? It's only been 26 months? You sure? Okay, in year 3 of a pandemic, why go into public health? I believe that perhaps unlike any other class in the history of the University of Minnesota School of Public Health, it's no coincidence that the class of 2022 has come to our profession. My hope is that as you go forward into a field that desperately needs your energy, passion, and commitment, that you and those here to support you can all lean into the reason you are here today and reflect on the season we are in. We are in what we hope is a once-in-a-lifetime season. a global pandemic that has taken 15 million lives and counting, 1 million and counting here in the US, with millions more left impacted by its wake, and a generational reawakening around racism's role in our lives. Both have reshaped our relationship with governments, with medicine and public health, with each other. You are also in a particular season of your life, whether your degrees and accomplishments being recognized today are the start of an academic or professional career in public health, or they're meant to enhance and deepen your clinical or administrative training in medicine, nursing, pharmacy, veterinary work, or perhaps you just decided to get a COVID degree. Yeah, I heard that's a thing. And now maybe be asking, what's next? Well, whatever is next, I encourage you to reflect on the season we are in. How has it shaped you and those around you? Perhaps, like me, you are getting used to having your 5-year-old coworker introduce themselves at random points in meetings, legislative hearings, media interviews. Or maybe, like me, you're more prone to waking up 10 minutes before your first meeting on Mondays, and less prone to wearing pants to work. I'm just playing, I still wear pants to my clinic. But as we continue to move through COVID-19, and yes, although pundits, political leaders, and even some of our own colleagues would like to declare it over, I'm sorry to tell you it's not. And so as we move through these stages of COVID-19, and as you prepare for what is coming next after graduation, I encourage you to think about the season you are in. What really matters to you and how you balance it can and will vary by season. Knowing what season you're in will allow you to set priorities, expectations, and boundaries, and it will allow you to better align all of those with your reason. So, what is your reason? To answer that question, it may help to know a bit more about my journey to share this moment with you tonight. My path to this stage starts with my parents and grandparents. My parents are both children of Cameroon, a country in West Africa known for being Africa in miniature, due to its incredible geographic and cultural diversity, as well as its great coffee, and a periodically successful and consistently frustrating men's national soccer team. My mother was born to 2 Norwegian-American Lutheran missionaries working in northern Cameroon. My grandma supported the mission by working as a nurse, and I'd argue as a public health advocate, helping improve sanitation conditions and promoting what we would call public health messages. My mother followed her example by becoming a nurse as well, working in labor and delivery. And my father's family can trace its lineage as far back as 1370 to the first sultan of the Bamoun Kingdom, Sultan Incharayen. My father was also a nurse before coming to the US to pursue education and training as a physician, but finding his way into the field of pharmacy. So healthcare is therefore a family business. However, growing up, I noticed that my parents wouldn't take their nurse or pharmacist hat off when they got home or went into our community. They would field numerous calls from family, friends, and community members about their current ailments and how to navigate the health system. Their example of a career that allowed them to help people in their work and in their community laid the groundwork for my reason. Finding my reason, however, has been a journey, one that I haven't walked alone, and one I think is best framed by one of my public health heroes, Dr. Kamara Phyllis Jones. Dr. Jones is a family physician and PhD epidemiologist, past president of the American Public Health Association, and for decades, she has led work focused on naming, measuring, and addressing the aspects of racism that impact the health and well-being of our nation. When asked what advice Dr. Jones gives to mentees, she has framed it in 4 guiding principles. Be curious, be a citizen, be courageous, build community. And so tonight I'll add 2 more, be intentional and be uncomfortable. Let's start with be curious. As many in this room know, curiosity is one of the bedrocks of scientific inquiry. However, the greatest scientists are exceedingly curious. They keep asking why, a trait seen in names that have become commonplace like Einstein, Newton, or Curie. And those who haven't gotten the same recognition, like Dr. Charles Drew, Benjamin Banneker, or Annie Easley. If you haven't heard of them, be curious, look them up. Many of those names you may not recognize not only pursued scientific whys, but importantly, they asked why our social hierarchy was ordered around constructs like race and gender. They actively challenged otherwise accepted social notions to not only advance science, but advance our society as well. An example in medicine and public health of continuing to ask why can be seen in the detailing and research into the social determinants or drivers of health. I first learned about the concept of social drivers of health in medical school through SNMA, the student branch of the NMA, or National Medical Association, the largest and oldest organization of Black physicians in the US. SNMA would host lunch lectures and share recordings of leaders like Harvard's David R. Williams, who broke down how the social drivers of health, like housing, structural racism and misogyny, access to food, education, and transportation, impacted an individual and community's health and opportunity, and drove the racial health disparities we learn about in class. This was my gateway to public health. I was confronted with the reality that if I was truly dedicated to being a healer and serving my community, I could not operate solely within the walls of a clinic or a hospital. Although you will soon have a new degree and letters behind your name, you may still be searching for how to marry your reason for this degree with the actual day-to-day work. By being curious, my reason came into form. Learning to be a better citizen helped crystallize it. Dr. Jones describes being a citizen as more than just civic duty, but having the capacity to care globally for the whole, to contribute one's gifts to the whole. Being a citizen can be hard, though, in 2022. One doesn't need to look far to see how the pandemic has opened up long festering fault lines within our society. We've witnessed individuals and groups participate in intentional disinformation around how dangerous COVID-19 is and how to protect oneself, and the resulting spread of that misinformation throughout our networks. In July of last year, Surgeon General Dr. Vivek Murthy released his first Surgeon General's advisory. Its focus was on confronting health misinformation, and Dr. Murthy noted at the time that every life that is lost to COVID-19 when we have vaccines available is a preventable tragedy, which makes the analysis done last month by Kaiser Family Foundation haunting. They estimated that between June of 2021 and March of this year, around 234,000 deaths could have been prevented by folks getting their widely available, free, and safe COVID-19 vaccine. A number that's hard to wrap one's mind around. And in addition to confronting this failure on a grand scale, for us in public health and healthcare, this crisis has manifested through an erosion of trust in our expertise, our intentions, and our integrity. Public health professionals have been yelled and cursed at, had threatening messages sent to their homes, and a survey last year showed that nearly 1 in 4 felt bullied, threatened, or harassed because of work. In this toxic discourse, it's crucial that we do what we can to regain trust where it was lost or forge trust where it was never shared. One way to do that is to follow Dr. Jones' next 2 pieces of advice: show courage and build community. And who better to lead with courage and community than a class that went into the field at one of its darkest hours? To help rebuild trust, I've tried to remind myself of 2 quotes in particular. One I first heard from fellow pediatrician Dr. Robert Needleman. Parents don't care what you know unless they know that you care. Our communities must know we care, and the one way to definitively do that is to show up. So the other quote I often think about, I first heard from the founder of the nonprofit Interfaith Outreach, LaDonna Hoy. You can pretend to care, but you can't pretend to show up. So to keep showing up in 2022 will no doubt take some courage. It will require us to keep pushing ourselves and our institutions to lean into discomfort and not simply go back to how we've always done things. To provide us with hope and a guiding light, we have so many amazing examples from COVID-19 of communities stepping up and pushing our systems to meet their needs and keep people safe. Like when the pandemic first hit and Black Nurses Rock Twin Cities President Kelly Robinson and her members went to the front lines, hosting testing and vaccination events in our community with medical professionals that looked like us, including working with Tito Wilson, Dr. Zeke McKinney, and the Minnesota Department of Health in North Minneapolis at Wilson's Image Barbershop, where they've been operating now every weekend for the last 10 months, vaccinating over 1,200 community members of all ages who appreciated that they kept showing up. Or the coalition of Asian American leaders who led their own analysis on where in the Twin Cities there were excess deaths in the Asian Pacific Islander community, finding although the burden of COVID-19 appeared relatively low among Minnesotans identified under the broad category of Asian Pacific Islander, when data was disaggregated, it became clear that COVID-19 was the leading cause of death among Karen and Karenni communities in 2020. Likewise, COPAL, or Communities Organizing Latinx Power and Action, and other organizations like Hacier, in addition to hosting testing and vaccination events, provided messages through social media and created and maintained a hotline for Spanish-speaking individuals to get connected to resources during the pandemic. And as vaccination first started, our tribal nations were able to dictate how their vaccines were allocated. They didn't hoard them for themselves or sell them to the highest bidder, but rather helped vaccinate those in their surrounding communities, helping those areas reach some of the highest vaccination rates for elders and other medically vulnerable people early in the state's vaccination campaign. To continue to show up along community will require intent. It will require us to not drift back into the complacency we arrived at 2020 in. We must continually ask ourselves, what is our reason? For me, I almost immediately think back to when I was walking through a Target in July of 2016 and first heard the murder of Philando Castile. I crouched down, almost on my knees, my hands on my head. The feelings today, almost as visceral as they were then. The powerlessness I felt from being witness to a man my age losing his life in front of his loved ones, including a 4-year-old girl, all because he was driving while black. And the anger that flowed afterwards, and the desire to do something, that desire to do, that led me to help co-found Minnesota Doctors for Health Equity. It led me to a recognition that although I was operating in service, I was avoiding the discomfort talking about racism and white supremacy in medicine inherently brings. And the more I leaned into that discomfort, the more I learned about how racism and white supremacy were weaved into what I was taught, how I practiced, the conversations I was having about where to live and where to send my child to school. I could not look away. As James Baldwin said about being black in America, to be relatively conscious is to be in a state of rage almost all of the time. And part of the rage is this: it isn't only what is happening to you, but it's what's happening all around you and all of the time in the face of the most extraordinary and criminal indifference. That rage and indifference is how I feel when I look at racial and health disparity data. Those numbers are Philando. They are George, Brianna, Dante, our unhoused neighbors, our friends and family living with a disability. Except in this situation, it is our public health and healthcare systems showing their indifference, taking an oath to protect and serve, yet too quick to disregard our lives and worth, unable or unwilling to stop even though so many are crying out, pointing out the harm, pleading to be seen and treated justly. The recently departed vanguard of public health and medicine, Dr. Paul Farmer, summed up the interplay of structural violence and indifference in a piece he wrote that was published in the last year of his life, stating, "Those whose lives are rarely touched by structural violence are uniquely prone to recommend resignation as a response to it." And there, class of 2022, gathered friends and family, lays the work we are called to do. Working in public health towards the common good requires that we do more than bear witness. We must do. And we must do more than critique what is wrong. We must build what is right. And building is hard. Building is uncomfortable. But if we are to see lasting change in our lifetime or our children's lifetime, then our reason, no matter the season, must drive us toward the discomfort of the unfamiliar. Discomfort, in fact, should be our guide. When I stepped into the role of Medicaid Medical Director for the state of Minnesota, I had my reason to help educate colleagues about how structural racism keeps our communities from reaching their full potential, and therefore keeping our state, all of us, from reaching our full potential. And to learn what Medicaid's role could be in addressing this inequity, and then push our system to do less harm and be more just. Therefore, I have an informal rule that I track. If I'm not having at least one uncomfortable conversation every 6 months, where I'm learning from community and growing, or I'm helping educate and advise decision makers, then I'm not pushing myself or the system where I believe we need to be. I am not fulfilling my reason. So perhaps, as you sit ready to get your degree, you aren't fully clear on what your reason is. Or maybe, like class of 2021 grad, Rohan Kazanchi, your reason is to grow a theory-informed and computational skill set for health services research and policy work in order to address upstream forces. Or, like class of 2022 grad Delaney Anderson, one of your reasons is that the biggest way to stand up to racism is to get involved. We can't continue to complain about systems if we don't take action. Or maybe your reason is to prepare countries around the world for their next public health challenge. or to help end the opioid epidemic, or to confront white supremacy and gun violence as the public health crises that they clearly are. Whatever your reason is right now, remember, it can and likely will evolve. And as it does, I recommend you continue to grow by being curious, being a citizen, be courageous, build community, be intentional, be uncomfortable. It's no accident that you arrived in public health during this season. I, my colleagues, and our society are excited for the many reasons you are here today and the work you will do tomorrow, even if one reason is that, for the time being, pants are optional. Thank you again, class of 2022, for this incredible honor. Congratulations. Celebrate this moment.
Thank you, Dr. Chomilo, for joining us to share your thoughts with the graduates. It reminds me, I spent many, many years reviewing grants for the National Institutes of Health, and oftentimes the grants were just describing the problem. 5-year, multi-million-dollar grants describing the problem, including health inequities and disparities. I'd review grants that were interventional, wanted to change that, and they were rarely scored at a level that would attain funding. We need to do, that's what separates us from a lot of sciences. Public health does. So I take that point from Dr. Chomilo, just do. Not just do it, I don't want to copyright infringement, but that's what we do. We have to change the world for better in the human condition. So thank you for that reminder. Okay, Dr. Chomilo is clearly impressive, but I'm going to turn the dial up one louder. One of the best things about being an interim dean and actually being a faculty member here, and that's one of the reasons I came here from Mayo Clinic, was to be around students. I love being in the classroom. I love being around students. They challenge, you do. It is my pleasure to introduce one of our star students, Delaney Anderson, who will address the class of 2022. I was really fortunate to meet her parents in an elevator. This isn't weird. I mean, she was coming here, and she got on, and we had masks on, and we didn't recognize each other immediately. And I met her parents, who came here from California for this today, as well as 7 other of her fan base are here. Ms. Anderson is receiving her Master of Public Health degree today in maternal and child health, and will be going to the University of Wisconsin-Madison in the fall to become a rural physician. So the fact that she's becoming a rural physician kind of offsets the fact that she's going to the University of Wisconsin-Madison, especially if she comes back to practice in Minnesota. Born and raised in Southern California, Ms. Anderson received a BS in Human Performance and Exercise Science at the University of Alabama. There, she became involved in the reproductive justice movement and dedicated herself to improving access to health services and community-led solutions. At the School of Public Health, Ms. Anderson pursued her intersecting passions of rural health, health communications, maternal and child health research. She worked at the Minnesota Department of Health Pregnancy Risk Assessment Monitoring System, or PRAMS, team, and completed award-winning independent research projects while still in graduate school. Outside of class, she is the director of the Rural Health Interest Group and has been a student leader in the Maternal and Child Health Interest Group, Diversity Network, and the wonderful student-led journal, Public Health Review. That deserves a whoop. That's better. In the larger Minnesota community, Ms. Anderson serves as a membership and communications co-chair for the Minnesota Public Health Association and as a media content coordinator for the First Unitarian Society of Minneapolis. For all this and so much more that we haven't even listed here, she was awarded the American Public Health Association Council of Affiliates Outstanding Student of the Year Award and the University of Minnesota President's Student Leadership and Service Award. Those are a big deal. But told you she was impressive. It's enough to make us all feel really inadequate. So please join me in welcoming the 2022 SPH Student Commencement Speaker, Delaney Anderson.
Hello, graduates. Hello, parents. Hello, grandparents. Hello, siblings and neighbors and friends and beloved ones. Hello to those in the room and those joining us virtually across the globe. I am so overjoyed to be with you today for many reasons. This honor is not lost on me, and I thank you for your trust in me. For those who do not know me, my name is Delaney. I am an avid knitter and a big fan of hitting end meeting for all when I host a Zoom. I am also a soon-to-be alumna of the Maternal and Child Health Master of Public Health program and will be pursuing medical school this fall at the University of Wisconsin-Madison to become a rural community advocate and physician. I am here with y'all today to reflect on our short time together as students and the long road ahead of each of us, illustrated via the universal experience of growth. Specifically, I will talk today about the life of our state flower, the pink and white lady slipper, and a fungus. I also want to assure you, I am not a plant biologist, and so today will not cover the finer details of plant life, nor the Latin pronunciation of names. I am not from Minnesota, but when I knew I was going to be attending our School of Public Health, I threw myself into learning about the state. This led me to a list of our state things: our bird, the loon; our drink, milk; sport, hockey. Perhaps to no one's surprise here, we have to have something to watch in these winters, right? The official flower of the state of Minnesota is the pink and white lady slipper. Part of the orchid family, its seeds are unique. They are as fine as flower dust. When dropped in the soil, each seed requires a fungus to find it and break it open and attach. The lady slipper would not survive without the fungus. Unlike most seeds, the orchid seed does not come stocked with a mini fridge of nutrients. They are dependent upon the arrival of the fungus for survival. This is not a quick process for the plant to grow. It takes many years to change from seed to plant. In its first year of life, the pink and white lady slipper only grows as tall as a pencil point. Its growth occurs maternal and child health student. Its growth occurs best in bright, bright sunlight, but can still thrive in semi-shaded areas. The transformation from seed to blooming wildflower can take up to 16 years. We, too, need time to grow. Since 1925, our state flower has been protected by state law. You cannot unearth, unroot, or pick the plant. The delicate pink and white lady slipper population in Minnesota has been harmed by road construction, habitat damage, wetland drainage. In other words, it has been harmed by us. All of us here today are like the pink and white lady slipper. Graduates, family, friends, all of us are delicate beings deserving of protection. All of us are dependent upon each other for survival. We were meant to bloom fully in bright, bright sunlight, but sometimes must fight to survive in semi-shaded chapters of our lives. We have not always been protected, cherished, cared for. The beautiful, wonderful, maddening part of pursuing a future in public health is learning very early on that everything is connected. No longer do any of us graduates think solely of a public health problem in only one dimension, because that truly wouldn't encompass the breadth of training and skills we have with us in the room today and virtually. I mean, come on, what would be the fun of making a conceptual model with only one input? Loved ones, please don't quiz your graduate on what a conceptual model is later tonight. Let them have one night to themselves. Jokes aside, public health thinking pushes us to examine interacting systems that can help and hinder health. We learn that to care for one individual, we must nourish the entire community by making assessments, diagnoses, communications, partnerships, policies, trainings, regulations, evaluations, education, and infrastructure for the public, for the health of the public. Those were the 10 essential public health services, by the way. All y'all graduates should be fitting in there somewhere. Graduates, we are entering a terrifying world. Studying infectious disease epidemiology during a pandemic that has claimed the lives of over 12,000 in our state. Supporting community health and revitalization efforts in a state marred by police violence. Working to brace essential health services at institutions vastly undersupported. I do not wish to dwell on the systemic failures us as students are all aware of and all too burdened by. I will not end today lauding self-care to fix burnout, nor the importance of resilience. I know that all of you here today, by earning a degree at the School of Public Health at the University of Minnesota, are driven and resilient and dreaming of a better world where health truly is a human right for all. I will instead end today by reminding you that we are a community. We are friends. We are family. We are soon to be alumni. Some of us already are. Some of us have new jobs waiting. Some of us will return to being students. Some of us may yet be uncertain of our next steps. Many of us feel quite the same. Each of us would not be where we are without the interaction of another. Like the pink and white lady slipper, we cannot thrive alone. We cannot survive alone. We cannot nourish ourselves. We each have had someone or multiple someones in our life act like the fungus and take care of us, supporting us before we could nourish ourselves and bloom. Today, tomorrow, next week, next year, in the upcoming decades, for the rest of your career, for the remainder of our lives, do not forget the power of community. Do not forget who has been a fungus in your life and who you will be a fungus for. Do not forget to support one another. Do not forget to lean into that support. It does not matter how long it takes to bloom. We are all unique individual seeds, but we are all a part of this larger community. After this moment, we will be carried away on the wind like the fine flower dust seeds of the pink and white lady slipper. We will fall far across the state, nation, and world. But in the iconic lyrics of Southern Country Queen and my personal Spotify top artist, Dolly Parton, wildflowers don't care where they grow. Hello, graduates. Hello, fungi. Hello, fellow wildflowers. We all are ready to grow.
Holy cow. We did that. The fungi had some role too. Well, the time has come. Today is a significant turning point in the lives of our graduates and families. So rather than considering this being the end, honor the definition of commencement. It signals and augurs a beginning to something new. You'll take all that you've learned in the classroom and in the field, from your professors, from one another, and use that knowledge to make the world a better place. I'm convinced of that. So I invite Dean Emeritus Dr. John Finnegan to the podium to present this year's candidates for degrees from the School of Public Health. He's already over there. I also want to remind our students and guests that you'll be invited to keep your masks on, even as you cross the stage, even if that makes you most comfortable. And in lieu of handshaking and hugs, you might want to consider a bow, a bumping of elbows, a tipping of your hat, or a double Fonzie. I'm aware that some of you might be Googling, what is a Fonzie? So, Professor Finnegan, it is your turn to introduce this year's graduating class.
Thank you very much, Dean Beebe. And let me just say before I begin here, I've done a lot of these commencements over the years, and I can tell you this is the first time I will be announcing all of the names. And we have professional faculty who usually do that, and Dr. Koopmeiners was scheduled to do this, and we hope that his health is improving. So if I do mispronounce your name, please, I beg your indulgence, and let's get going. And we begin with the Master of Healthcare Administration. Moriam Yarrow. John Weehee. Allison Weedman. Rahuth Verma. Jessica Vatiprulu. Milan Laurukalo. Farhan Siddiqui. Shane Seifert. Vanessa Santamaria. Marissa Sandcooler. Rebecca Roof. Gavin Reynolds. Rachel Rahman. Daniel Okabwe. Louis Monette. Brandon Milne. Dominic Mejin. Molly Ann Kramer. Lauren Kohler. Claire Knutson. Emily Johnson. Margit Herman. Jacob Haag. Megan Helfers. Priyu Gupta. Muskan Gupta. Aaron Green. Chloe Goodman. Jamie Gorder. Sarah Culver. Marie Bonine. Samta Bukta. Ashley Avilas Brizuela. Lucas Anderson. Helena Abermanis. Brock Aberley. And now we move to the graduates of the MHA Healthcare Administration Executive Program. And we begin with Brenda Johnson. Mary Johnson. Amy Ninham. Amit Barguva. Curtis Batulis. Justin Bachman. Osimadita Ane. My apologies. And now we move to the Certificate of Public Health specializing in clinical research. Pardon? Community health promotion, sorry. Thank God for students. Nicholas Zerzan. Austin Tao. Maichua Yang. Chua Shang. Julia Tyndall. Siona Burrell. Jordana Mithun. Michael Garber. Lydia Shields. Lydia. Thank you. Grant Zostopil. Maylen Anthony. Rune Maktal. Faiza Hassan. Emily McGuire. Marilee Singaruja. Sophie Elsenbast. Carolyn Hankey. Sarah Steffen. Tara Cantwell. Elizabeth Magnuson. Jill Collins. Amy Almquist. Carissa Trekus. And now we move to the MPH in Environmental Health. And we begin with Alexandra Kurtz. Ridwan Saeed. Hoden Hachi. Gabrielle Johnson. Yiwan Esther Song. Emma Roth. Mary Gromek. Laura Johns. Jessica Livingston. Bailey Atkinson. Rebecca Schonecker. Thank you. Anna Frixell. Chiwanwa Aihimi. Jessica Yeskus. Lisa Hunwardson. And now we move to the MPH in epidemiology. And we begin with Jessica Shamdas. Anna Loper. Shannon Bach. Paige Dietrich. Audrey Enerson. Paige Richmond. Emily Davis. Alexandra Rausch. Michelle Holmes. Madeline Poronsky. Zamina Karim. Natalie Jantasek. Amanda Gordon. Jaden Anderson. Stuart Walukaga. Catherine Giorgio. Megan Sickle. Emily Grebner. Guy Thomas. Gabrielle Schmidt. Helena Schoberg. Samantha Struble. Idris Mohammed. Madeline Nones. Luke Lenners. Chinar Singhal. Mizan Gebre. Victoria Wynn. Lauren Duval. Anne Youngblood. Asha Elganda. Paige Wolf. Allison Goldbeck. Kate Macklett. Joseph Akambase. Farida Ikoe Heta. Eustacia E. Carey. Sally Brandt. And now we move to the MPH in Maternal and Child Health. Madeline Weinkoff. Sanais Hall. Aaron Martin. Rebecca Wonder. Taylor Lees. Audra Gaikowski. Caitlin Traub. Shay Gingris. Bridget Laswell. Kelsey Fitch. Lauren McPherson. Delaney Anderson. Courtney Kutzler. Isabella Rowland. Paige Erickson. Cassandra Edland. Crystal Klicka. Claire Newby. Brenna Jarvis. Shay McGrath. Rebecca Lindholm. Mew Mew A. Carolyn Uppis. Megan Lohr. Hadijah Steen Mills. Fabiola Ramirez. Alexis Chavez. Zenab Tiamiu. Hannah Johnson. Claire Huber. Delilah Robb. And we now move to the MPH in Public Health Administration and Practice. Robert Brame. Tara Viken. Jody Lewis. Kate Weiss. Delane Thibault Thomas. Switch batteries. Jacob Abrams. Madeline Turbis. Jeanette Romero Science. Madeline Herr. Karen Chen. Safia Abdi Noor. Ayan Jama. Amina Abdulani. Sina Tikabo. Alexandra Koima. Thomas Leiden. Suwaida Hussein. Ido Salad. Denny Vang. Parker Anderson. Thomas Slagerman. Julia Niep. Kennedy Corpy. Clarice Martell. Rachel Motakwu. Mackenzie Heck. Keely Hayden. Keithana Igathisan. Jackson Sewell. Amira Iromo Selly. Mariana Blair. Meredith Gingold. And now we move to the Master of Public Health in Public Health Administration and Policy, the executive program. Victoria Traxler. Melinda Stewart. Beatrice Menito. Lori Kabangnu. Emily Dennis. Natalie Vasile. Jennifer Owens. Seamus Dolan. Kyle Long. Nahid Murad. Rebecca Asham Keller. Taka Ro Ann. Yasmin Odowa. Maya Wedlow. Chao Yang. Jordan Hennick. Eric Clemenson. Megan Reardon. Amanda Thunheim. And now we go to the MPH in Public Health Nutrition. And we begin with Joshua Bentley. Rayanne Goins. Kelly Dillon. Faith Rasmussen. Melissa Vang. Cassandra Twiggs. Natalie Hogan. Sydney Meyer. Garrett Wagner. Cecily Weber. Alyssa Brown. And now we move to Public Health Practice, MPH. And we begin with Denny Chomilo.
Yeah, Jenny!
Jenny, sorry. Jeffrey Merkel. Tai-Ying Lee. Gamada Hussein. Dakota Olson. Jacqueline Oakes. Dr. Becca Friends. Dr. Caitlin Lunasek. We move now to the MS in Biostatistics. Andres Argades Levi. Eric Connor. Jessica Hellner. Jio Zhang. Anthony Johnson. Shalma. Mingming Pan. David Schneck. Daniel Whitford. Linnea York. Okay. For the MS in Environmental Health, Mariam Zahidi. Jia Zhang. Hoju Zhao. And for the degree of MS in Clinical Research, Janine Pebbles. And for the MS in Environmental Health, Natalie Eichten. Mito Imagwa. Juliana Rushing. Now the MS in Health Services Research Policy and Administration. Anna Beckstrom. And with that, we will now move to the Doctor of Philosophy students, which is the highest degree that is awarded in the School of Public Health. And we begin with Grace Leiden, PhD in biostatistics. And putting her today will be her advisor, Associate Professor David Vach. This is the hard part because the more degrees you get, the more help you need dressing. Maria Anna Masati, PhD in biostatistics, and her advisor is Assistant Professor Lin Zhang. We did a practice session earlier to avoid strangling anyone. For the PhD in biostatistics, Mengli Xiao, and Professor Haitao Chu is her advisor. And now for the PhD in environmental health. We begin with Doug DeMolin, and hooding him is Associate Professor Yun Kim. This is always the fun part, yeah. There you go. Yeah. Close enough. Very good. PhD in environmental health, Yoon Sung Nam. And hooding Yoon Sung is Professor Marizan Ramirez. And now for the PhD in epidemiology, we begin with Colin Calvert. And he will be hooded by Associate Professor Darren Erickson and Professor Rhonda Jones-Webb. Takes two in epidemiology. For the PhD in epidemiology, Emily Graney Faraday. And she will be hooded by Professor Shalini Kalasingham. For the PhD in epidemiology, Jessica Friedman. And she will be hooded by Associate Professor Susan Mason. PhD in epidemiology, Jennifer Garris, and Professor Logan Spector will hood her. Lindsay Lesher Erickson. And for the PhD in epidemiology, have a seat. And Professor Tobin Nelson is her advisor. Junia Noguera de Brito, and she will be, her advisor is Professor Mark Pereira for the PhD in epidemiology. Naomi Thiden. For the PhD in epidemiology, her advisor is Associate Professor Teresa Osipuk. Wendy Wang, PhD in epidemiology. And her advisor is Associate Professor Pamela Lutzy. Serena Sayong, PhD in epidemiology, and Associate Professor Emerita Deanne Lazevich and Assistant Professor Rebecca Pratt are her advisors. Chris Frenier, and this is for the PhD in Health Services Research Policy and Administration, and his advisors are Professor Peter Huckfeld and Associate Professor Ezra Goldberstein. Also, the PhD in Health Services Research Policy and Administration, J-Mag Carbia. And her advisor is Associate Professor Rachel Hardiman. Cynthia Kenyon. And this is for the PhD in Health Services Research Policy and Administration. And Cynthia's advisor is Associate Professor Katie White. Sydney M. McGuire. And Sydney's advisor is Associate Professor Sarah Gollist. Henry Stabler. And Henry's advisors are Associate Professor Katie White and Interim Dean and Professor Tim Beebe. Tim gets to do double duty on this one. Congratulations to the class of 2022. I now have the privilege of introducing Kaylin Almach. She is an MPH student in maternal and child health. She is the current SPH Student Senate President, and she is going to introduce the Public Health Professionals Pledge. Kaylin.
Thank you. One of our most treasured commencement traditions is the recitation of the Public Health Professionals Pledge. This statement affirms our shared goal in promoting the health of populations, and it unites us as a profession. Class of 2022, it has been a privilege and a joy to learn from and alongside you all throughout this past year. It is now my honor to lead you in the pledge, which is printed on page 27 in the back of your program. Graduates, please stand as you are able. It's your turn now. And repeat after me. As a public health professional, dedicated to enhancing the health status and well-being of individuals and communities, I pledge to hold the public interest and health of populations as my high professional goals. Congratulations, School of Public Health, Class of 2022. Graduates, please be seated.
I hate to break this to you, but you're not official yet. So close, so close. You're soon to be official alumni of our school. You'll be joining more than 12,000 living alumni of this school. Our alumni have become national health ministers, hospital CEOs, state epidemiologists, leaders within the World Health Organization. You join a distinguished group of people who share the commitment to make the world a better place and healthier place. I have no doubt that you too will make your mark if you do. The reference in you again. So here to deliver a message of welcome is Karen Wick, past president of the School of Public Health Alumni Society Board. Ms. Wick received her Master of Public Health degree in Environmental Health in 1994. Karen has 35 years of experience in the medical research field and clinical research development. Her public health passion is the opioid epidemic, and her tenure as Alumni Society Board president has asked her fellow board members to focus efforts on tackling this public health crisis, which is still ongoing and accelerating. Please help me welcome Karen Wick.
Greetings, class of 2022. My name is Karen Wick. I am a proud alum who received my pharmacy degree in 1983 and a Master's of Public Health degree from the University of Minnesota in 1994. I served as president of the Alumni Society at the School of Public Health and currently serve on the board of directors. I'm also the president and owner since 1994 of Stephan Research, a clinical research consulting company which fulfills the research needs of companies in both the pharmaceutical and medical device industries. It is my honor and privilege to be one of the first to welcome you to the School of Public Health Alumni Society today. Since its inception in 1982, the School of Public Health Alumni Society has worked to serve alumni, students, promote excellence in programs, and advance public health efforts in our community and the world. The first degrees and certificates in public health were awarded by the university in 1935. Today, in 2022, you join a community of around 12,000 alumni from the School of Public Health. Our graduates span the state, country, and globe.